Welcome, guys, back to the Birthling podcast. Listen, I'm really excited to get into this episode. We finally have another birth story. I have a few women that I have asked if they'd like to come on and share their story, and they're always so excited to do so. But it is hard to get moms to be available to record. So I'm patiently waiting. And when I do have one, I get really excited. This week, we're going to talk to Sara, and it was really cool to speak with her. It was a blast from the past because she's been following me on Facebook and Instagram, and we have been friends since, oh my gosh, middle school. And we were on swim team together in high school, and we were in a humanitas class. You guys know humanitas? It was when we were taken from one, like we had multiple classes together as a group. So in high school, instead of going to a new class where there's like all new students, we moved as a class to different subjects. Does that make sense? So we were in humanitas together. And, high school happened, graduation happened, and then we lost touch a bit, which happened with me with most of my high school friends. But that's when I am so thankful for Facebook and social media and ways to stay connected somehow. And I'm glad that the Birth Link and my friend's a nurse connected with her. She saw something that she really just connected with, and I hope you do too. So I'm just a real person that went to nursing school. I wanted to deliver babies, and I have seen something in the system that just needs a little fixing, and I want to support you, not just at the bedside, but beyond. Right. So I know February cohort is going to be starting soon, so I can coach you through your pregnancy into your birth. I have a mama in labor right now, so I'm like constantly checking my phone, and that's what you get with me. You get someone that is going to be able to text you and call you throughout your pregnancy, but also during your birth, during your labor, during your induction, what's happening. You just feel totally supported. And when you get home, maybe we won't speak as much because I know you have a whole nother priority now. Everything you have been planning for is in your arms, and that's how it should be. And hopefully you are so prepared that you don't need me too much after that. But I am here. So if you need to reach out with any questions that's happening postpartum or with your newborn, that's what I'm here for. So I hope that connects with you. I'm so glad that it connected with Sara, even though she's already had her babies. So she got on and started telling me that how she connected, how her pregnancies and her birth experiences before shaped her, how she saw the system for what it was. And this isn't going to be like a tragic birth story. This is just her telling her, like us, how it is, how it went. And I was really excited to hear it. It was 3 very different birth stories for her. She has 3 kids, and we kind of focused on one. That was a little exciting, and I hope you really enjoy it. So let's get started and talk with Sara. Welcome to the Birthling Podcast, presented by My Friend's a Nurse. I'm your host, Colette McCullicher, a high-risk labor and delivery nurse right here in sunny California. I'm also an OB certified specialist, birth educator, lactation expert, and mother of 2 beautiful daughters. I am passionate about guiding you through the miraculous journey of pregnancy and childbirth, using evidence and history and asking the reason why. I have some incredible medical friends and colleagues, and we're all here to help you navigate this often overwhelming birthing hospital system in the United States. My goal is to gain trust in birth, improve this system, and provide some valuable insights. Let's make this journey a little less daunting and a lot more joyful. Let's get into it. Hey, welcome to the Birthling Podcast episode where I have a birth story for you guys. It's been so long since I've been able to get a birth story because guess what? Moms are really busy. I just have to say that. Sara, I'm so excited that you asked to be that you just wanted to talk to me. And then I guess I was like, please tell me your story because it just was interesting right off the bat when you reached out on Facebook. And I just have to let everyone know, Sara and I have been friends since was it junior high? I think so. No bell?
Possibly. Definitely high school in your orange
High school.
BMW.
Yeah, my little Skittle that I call my Skittle. I had a 1977 BMW series, and it was a highlighter among all the cars in the parking lot. Everyone knew when I was at school and when I wasn't. But how have you been? It's so nice to catch up.
Yes, likewise. So I've been wonderful and chaotic since you and I have seen each other. I've had 3 kids. I know you've had a couple kids. How many
I
kids
have
have you
it.
had?
I have 2 kids, 20 years apart, girl. So it's like I was busy raising one, finished. I was like, I'm done. And then I met my husband. I'm like, I guess not. Guess we'll have one more. He's like, I don't think this is gonna work out. You're 38 years old, and I want to have kids. I want a kid. And I'm like, I can have a kid. I got a kid. I look at I'm 38. So I think I was 37 at the time, like just turning 30. I'm like, I can have a kid. And I had her when I was 40. So 20 years apart. It was crazy. What about you? Tell me. So we're here to talk about you, and I want to know, like, tell me a little bit about the first one, 17 years ago. So not long after I had Jordan, you
Yeah,
had
so
your
not
son.
not that long ago. I think a lot of things have changed in terms of technology. I did go to a baby convention thing back in 2015, and I was shocked that they had these electric strollers that you could push and it gains charge so you could charge your cell phone. So in that respect, a lot has changed since 2007.
Girl, strollers are like as expensive as like motorcycles and cars. It's crazy.
Yes, indeed. So that's where my first birth story happened. So it was 2000 May 2007, May 11th, 2007. I had my first son, Mr. Jack William Fisher. I did not know his gender. So we had 2 sets of names picked out, but I was hoping he was a boy because I liked the boy name better. And it was just as simple as that. So when I was pregnant with Jack, I was living in Big Bear at the time, which is a very rural community, and that has not changed. It is still very rural. And they have one, or at the time, they had one Medi-Cal OB. And of course, I was a young mom, unmarried, so I was on Medi-Cal. And you had a monthly appointment. So you knew the same moms. You got to be friends with the same moms because everyone had the same monthly appointment. So, of course, it went from I don't even remember. It was so long ago. You had your every few months, and then, right, it was monthly. And so we got to be friends. And she actually, my friend, we became friends. And she had a baby. Her baby was born the exact same day. And during the time, she would tell me, when my baby's born, I'm going to start a daycare. Well, the baby was born the same day. She did start a daycare, and I sent my son to her. So that was lovely. That was something that worked. But let me back up to before he was born. Before I'm kind of bouncing all over the place here, as I guess you do when you're talking about your kids, right? Get so
Yeah, definitely.
excited. So basically, it was really interesting because I could go once a month to my prenatal appointments, but if there was anything that happened that was amiss, you needed a stress test, an ultrasound, any prenatal care besides the very, very basics, we had to drive all the way down to either Arrowhead Regional Center or Loma Linda. So, when you're pregnant, you want to have access to close medical care. Luckily, I had a very healthy pregnancy up until about 28 weeks. I started having some contractions. I didn't know what to do. I didn't know what was causing them. I didn't have a doctor that I could call. So I ended up just going to the ER. And just to show how complicated it can be if you don't have medical care, prenatal care close by, they actually had to airlift me all the way down to the hospital because they don't even have the correct equipment to check if your baby's okay. So it turned out I was dehydrated. They gave me an IV, sent me home a few hours later, and everything was fine. So that was really the very first eye opening experience that I'm up on this mountain and I don't have care. I don't have medical care for my unborn child or for me if an emergency happens. So fast forward to the day before I was due, around midnight, I started feeling some symptoms. So, of course, I popped in my VHS of Friends and I watched Rachel giving birth, because that comforted me. And the time my boyfriend was asleep, so I wanted to let him, kind of sleep. So I made it until I felt probably one contraction, maybe every 20 minutes. And I thought that meant I was going to have a baby. And since we had a long drive down the hill, we drove down. We drove down the hill, and I got there, and I was only 3 centimeters dilated. So of course they didn't want me there hanging around, but we lived far, so there was really nowhere for me to go. So they admitted us, and we just walked and walked and walked around the hospital. Um, we had to go in, certain times just to check so the nurse could check. No progress.
You were walking around, and go back to like what kind of education you had during your like prenatal period. Like
Oh,
you had
yes.
mentioned something you didn't want medication, right?
Yes, perfect. So back to not having great, accessible care. So the local mom and dad project, which was a nonprofit, sort of post delivery, they would help with all types of different services, providing resources to new parents who live in that rural community. Most of them are low income because of just the demographics that are up there. So I attended this weekly prenatal class, this birthing class. I was on my own. And the nurse that did it, she was lovely, and she educated us on all different types of pain management, right? And what different pain managements would do, and the pros and the cons. So, based on that, I made the decision that I wanted to have as little medical intervention as possible. Of course, I knew that if I needed it, I would accept it and whatever needed to happen, especially if there's an emergency situation. But I really wanted to try to birth this child trusting my own body without the medical interventions. I didn't know exactly what medical interventions did, but I did know that it caused a longer recovery for a lot of moms that I had talked to and some just unwanted side effects. So I was really set. Now, remember, this is 2007, so there wasn't smartphones. There wasn't Facebook to go to your local, moms group. There was no Google, nothing. I was just chatting. I didn't even really have a reliable cell phone because the Verizon towers weren't all over. So I was really just talking to the grandmas that I worked with. I worked in a social service office with a bunch of therapists, right? So even then, I just got a lot of, well, you want to be comfortable, loving that type of stuff, but not a lot of really good medical information. And I didn't even know what questions to ask because I thought I had been told everything I needed to know. I don't want pain management. So fast forward again, bouncing back to me walking around the hospital, checking with the nurse, no progress. She says, you know what? She says, I know you didn't want any pain management, but let's just give you a little bit of Pitocin just to kind of speed things up a little bit. I think it'll make you more comfortable if you're not walking around, in this state for so long. Let's just get you going, right? It's your due date today. Congratulations. So of course, I had no idea what that actually meant. So I said, okay, yeah, excited, 25-year-old, want to meet my first baby, had been up, 48 hours watching Friends. So I said yes. What I didn't understand was the Pitocin. I knew it wasn't a pain relief, but I didn't know that it would actually make it feel like there was an atomic bomb going off in my uterus every time I had a contraction. And the worst part, I remember I experienced one of those atomic bomb contractions as I was looking through the window of the nursery with the babies that were born, because back then they did that a lot more. And I happened to see a 10-pound newborn. Of course, my jaw dropped. I imagined newborn babies were much smaller than that. Luckily, the nurse was there and said, that mom had diabetes. Don't worry. That's not the average size of a baby. So anyway, in pain, atomic bomb. At this point, the contractions are getting so intense I can't even walk. So, but I have pride, and I don't want the pain medication. So, okay, it's not hurting. It's not hurting. So I go back to the hospital bed. I get checked again. At this point, I don't remember exactly, but I have made some progress. So maybe around 6 centimeters. So a lot happened during walking around those floors. So at this point, I'm in excruciating pain, just agony, can't hardly handle it. I'm exhausted. So the nurse says, "Look, you're in a lot of pain. I know you don't want pain medication, but I can give you something that's just very light. It's like maybe one drink, one cocktail, would that help?" So I reluctantly say yes because I thought I was actually going to die. I felt like I was dying. It hurt so bad. So the nurse gives this to me, and then however long later, I'm not sure, I basically realize that I'm just drunk, So now I'm drunk and I'm passing out between contractions. The contractions are waking me up. I am confused and I'm yelling and I'm cussing and I'm exhausting myself. So that was basically how the transition, is that how you say, basically from around when I first start making some progress to just before my son is actually born, and the pain is just so intense. And it's because I was so exhausted. The birth class that I took didn't actually teach us that part of it. They really only gave us the different pain medications and then different breathing techniques. But I was so far gone at that point that, the breathing was just voluntary almost at that point. I wasn't even paying attention to the breathing. I was just in my mind trying not to die from the pain. So anyway, I knew I didn't want to have a C-section. That was really important to me. And so I attempted to have this baby with just the support of my partner and the doctor and the nurse. And before I know it, everything's beeping and lights are flashing and nurses, and all this in my room is filled with people who look scared. And I don't know what's happening. And the doctor didn't tell me. He doesn't tell me anything. He's not my doctor. He's just whatever doctor's on call. It's a county hospital. I had never even been to this hospital before, and they try everything. So they go ahead and they stick as I called them, the jaws of life. You were a little bit more medical and described them as forceps.
Forceps.
Okay, fine, but
Jaws of
maybe
life.
I'll let you say
I
what
mean,
they
I
mean.
think it's a better name, actually, Jaws of Life.
So, and maybe you can help your listeners describe what happens during that process. I don't know what happened, which is also part of my trauma. I don't know what happened. I do know they used forceps because they said we're going in. The forceps slipped, didn't work. So then I had to have an episiotomy so they could try to reach in and get him more. That didn't work. His heart rate starts dropping. Everybody starts freaking out. So then they go ahead, and I didn't know this until after, but they did the suction cup, so they suck the top of his head and pull him out, and out comes the baby. It's a boy. So amazing. I look at the boy, the biggest cone head you've ever seen, which I was really disappointed because I didn't know that was part of normal, but also part of a long extended delivery with all of that type of stuff. So I was still a little bit drunk too from the medication. So just not being prepared was traumatic for so many reasons that we can get into in a little bit. But then after my baby was born, another part that was really unexpected was that they had to repair the episiotomy, which I had no idea. So I had the baby, I was cuddling with him, skin to skin, and then all of a sudden I feel pain again, which is them stitching me back up, which I had no idea. And that was upsetting because that was scary for me too. So that was kind of, all of that was just a blur of pain, of excitement, but of also really feeling scared and out of control is the best way I could describe it. And I think if I could do anything, what I would have not done is I would have not taken the drug to make me confused. I would have rather just had an epidural where I could have at least been more mindful and present in my birth. Maybe I wouldn't have felt it physically the way that I had wanted to. I would have been able to be there more mentally. And I really, really didn't like not knowing what happened from 9 centimeters till I'm back in the recovery room. Basically, it's all lost, and it's something that I can't get back. I've reviewed my medical records since, just to kind of look and see, and no one did anything wrong. I just wasn't prepared. I was young. But that's the biggest thing, that I wish that I didn't take that one medication. I think that would have really changed the trajectory of the whole birth experience. And then to make matters worse at that time, and I don't know if this was true for you with your daughter, but they were really pushing formula in the hospital. There wasn't lactation consultants. It was just, here, we're going to send you with all these different samples of formula. I knew that was not something I wanted to do. So I was trying to breastfeed, didn't know how. Every time the baby would cry, I would cry because it hurt and I didn't feel successful. So it was just really hard. I ended up going home with this newborn baby. I ended up getting a terrible UTI. mastitis. So everything ended up being fine, but that's the gist of my firstborn. So I knew when I had another baby, if I was going to have another one, I would want to be educated with every possible scenario that I could at least think of or find. So I wanted to talk to as many women, which is also why I wanted to share my story in hopes that
Yeah,
helps them.
you didn't get an epidural with this one.
I never have had an epidural with any of my
That's
babies.
amazing,
Yeah,
actually.
so you can imagine how much it hurt with
Like,
Pitocin and no epidural.
absolutely. And
And
forceps and
yeah,
vacuum and episiotomy. So they probably gave you some lidocaine, a local anesthetic, but they need a lot of it to really numb that area. So I'm sure that, and if it wasn't much of a conversation about what they were doing, that can be quite shocking. Like, what are you doing? It sounds like you had the works, Sarah. You got the works on this, getting this baby out. And I just want to, for listeners right now, Pitocin and walking around doesn't really happen anymore unless did you have cordless monitors? Were they monitoring your baby the whole time?
no.
Yeah, so nowadays with Pitocin, like, you can't be walking around. So that's kind of cool that you were able to walk around on Pitocin, though, because we cause these contractions to get stronger and sometimes too strong, and your babies don't like that and their heart rates dip. Nowadays, we have to watch your baby while you're on Pitocin. Same thing with epidural. So you'll be more stuck to your bed with Pitocin nowadays. And same with the narcotic. As soon as you get that drug, like, you're not going anywhere. You can't, because they're fall risk. And, just wanted to point that out. And then how long did you have to push for? Do you remember?
I definitely remember. It was 22 hours of active labor.
And then what about pushing?
Many, many hours. I wouldn't be able to tell
That's
you, but yeah.
crazy. Yeah.
And compared to my last one, which was about 5 minutes of pushing, yeah.
Yeah. Yeah. That's a long time to push. And I know you probably did, because if they're going in with forceps, which I visually, they look like really big salad tongs. And they put one around one side of the head and then they stick in another one on the other side of the head, right? So I guess this would be better. And then they just clamp down and pull out in a certain way. And you have to be very experienced to be able to do that. The risk is trauma to the vaginal wall. And also for the head, if it's not pulling, they can't really pull. They have to really glide it out. They used to use those. They used to knock the mom out and use those, so they didn't even have to push. As soon as the baby was low enough, they could just kind of scoop the baby out. It was crazy. And then you had to have an episiotomy at that point because probably not enough space. And then you had to get a vacuum on top of that. I've personally never seen a vacuum after forceps. That's crazy. But it just goes to show you, like, I don't know if it was impatience or your baby was having probably a huge deceleration. The heart just tanks, and they're like, if we can't get this baby out right now, then we need to go for a C-section, because this baby needs to come out right now. So much so that they felt they didn't have time to explain anything to you. But what would have it meant if they just took the few seconds to look you in the eyes and let you know each step of the way what they were doing? How would that have probably changed your whole perception of the experience?
It's a really good question. I can't say for certain. I mean, I definitely wish they did. In retrospect, I feel like it would have made it much less scary. But by the time they got to that point, I'm not sure if I would have even heard what they were saying, because it went from me walking around looking at fat babies to everybody in my room, every alarm beeping so quickly that I don't even know. I mean, maybe they did say something and I missed it, but there was surely no one there to make sure that me as a person, I was okay. It was really all about just the birth of this child, and I was just sort of there, not really there. My body was there, but I didn't feel like I was a patient at all, or even really a human, to be very honest.
I
I
felt
definitely didn't feel
I
like,
felt the same
yeah, I definitely
way.
didn't feel like a woman, just they were just, down there. I say jaws of life because it felt like an auto mechanic, just opening up the hood and doing what they needed to do. There was no even asking me how do the brakes feel, nothing. And I definitely was not prepared for after the birth, knowing that there was still repair. That, especially just in all my confusion, I got terrified, and I started crying, thinking that there had been damage that I didn't know about, which I guess there was, but it was in the range of normal, but I didn't know that. And I also didn't know that the aftercare would be so different, and that's why I'm sure I got just such a raging infection, and I was just so sick, and even then being sick, I didn't know what to do because I didn't want to go to the hospital with my brand new baby. So I, I think that I think the information should have started at my prenatal appointments. I appreciate the community classes. They were free, provided to the community. So I'm not entitled to anything specific, but I really feel that my providers of the prenatal care, especially closer to my birth, I really wish they would have explained the process more, and that the difference between pitocin, if you get pitocin, ladies, you have to have pain management. I mean, it's just, I wish someone would have said that, and I didn't know the relationship at all. In the time, I wish maybe they could have told my partner what was going on, and then he could have explained it to me. That might have been a good way to get information to me. But they, from my recollection, they didn't even speak to either of us. They just spoke to themselves, and that was it.
We seem to be very nonchalant about Pitocin. I feel like Pitocin, and nothing's really changed with regards to that, but I'm not discounting or discrediting Pitocin for what an amazing drug it is and for what it can do. But to just be like, we're just going to give you a little Pitocin to speed things up, it's not giving it the respect that it needs for like the power that it has. Like why the net, like why do we need to speed things up all of the time? We need to do more to elicit some patience with it, all of us. So from the healthcare professionals to the moms to the dads, to understand that this is a long process sometimes, especially with your first baby, but that it could be longer but safer, and then giving you that option, like, no, that then it would be in your hands, like, okay, understand the risk that it's going to be a lot more painful and that I may need that pain management, or would you like it to be maybe 6 more hours or 12 more, take 12 more hours, but it's going to be a gradual, more, what's the word, like, you're going to be able to handle it a lot better so that you're not going to need to be drugged with, you probably got a narcotic. They gave me a narcotic, I remember, and I felt drugged too. And I don't remember asking for it. Like, I think they're just like, we're going to give you something to help you. And I think it was because I had an episiotomy as well. So once they gave me the episiotomy, I was like, whoa. I was like, oh, what's that button? Like, I was disassociated from the baby. I didn't connect. Like, I usually say, and it sounds like it's the same for you, I felt like I was in this tragic accident. Like, as soon as it was time to deliver, like, it was like a bright light on me, and there was like, it felt chaotic, but now that I'm in the field, I know that it's not chaotic, but it does feel like that when you're not prepared to have all these people in the room and all these things beeping and all this, then your legs are in the air and you're like, and you're just laying there like a rag doll, like, okay, do it to me. Like, did I just get in this tragic, like, motorcycle accident or some kind of accident where I'm in the ER and then things are just done to me to save my life? Like, are they saving my life right now? What's going on? And it wasn't until I was in, like, I'm in the field and now I'm on the other side of the bed, then I'm like, no, she's just having her baby. Why are we treating her like this? And so I've, over the years, have had to change totally how I care for moms so that I can be present for her. Like, how are you doing? And using her name and speaking calmly and letting her know at least someone in this room is here for you. And it took some time to get there because with all the training, and this is, I say this a lot too, is like I started out in labor and delivery wanting to take care of my 20-year-old self, wanting
Wow.
to provide, yeah, I wanted to provide some reassurance to her that we are here for you and I'm going to protect you and I'm going to help you through this. When you don't know what's going on, I'm going to make sure you know, like, that I'm here. Like, you don't have to know every little thing going on, but I'm here and you're safe. So, but then over the years, as soon as I entered labor and delivery and I was trained, it was like protocols, policies, skill, like hemorrhages and shoulder dystocias, emergency. Like we had to start learning and acting so quickly that all of a sudden it was very fear based, and we are running and making decisions based out of like, what's wrong? What's going on? What's this? And then we're so preoccupied with checking all the boxes and making sure everything is set up right and that the doctor is okay, because the doctor is such a force to be reckoned with. Like they're going to make all these demands, like they're the ones having the baby, that I quickly forgot about that 20 I quickly forgot about that 20-year-old self, like that 20-year-old girl that just needed someone to be there for her. And I just wanted to save her life, because that's how they made me feel. That's how they trained me. And it really took me stepping out of that and looking from a different view and started asking, why are we doing this, to kind of remember her and go back to her. So at least in the last few years, I've been able to do that. And it's completely changed how I care for my patients and how they respond to me. And I hope that they have a better experience with their birth that way. And so far it seems so that even if we do have an emergency and I have to race her to the EOR, she can look at me and be like, that was okay. Like, we did what we needed to do. Like, I was there. I was part of the team. I was part of this. It wasn't happening to me, which it felt like it doesn't feel like it's just like everything's happening to you. It's not like you're even part of it. It's like they strip it away from you.
Absolutely. You said it perfectly. That's exactly how I felt. And I was not expecting it. And let me just on that note, actually I have a couple thoughts while you were talking that I want to share with you. So mostly they're questions.
Yeah.
But one of them, just with you and I, we were sort of lucky in that there wasn't social media at that time. Because I feel that if I had seen what some births look like with the welcome baby banners and their makeup is done, and if I had seen that and then compared it to my experience, I probably would have been more traumatized, to be honest, because going in, I didn't really know what to expect. But if I was expecting something like that, it would have probably been much worse. So that's something. But the question I wanted to ask you was, so now that you're a labor and delivery nurse, correct? And you're also now a coach, how much are you allowed to bring your own personal coaching perspective? How much freedom does the hospital allow you to have in your nursing job? And also, so my last job, I was a case manager for a hospital, big hospital chain here in Southern California. And one of my jobs was specifically to do short-term case management to reduce readmissions, right? And that type of community healthcare worker is becoming more prevalent in the medical field. Do you think that if enough awareness is raised, maybe birth coaches will be part of the team? Not, I don't want to say just nurses, right? Because nurses obviously play such a huge role. But in addition to that, a coach that, maybe isn't a doula, maybe is a nurse, but just someone that knows what they're doing, but also knows what the patient needs, because either they've been through it or they've studied it, or both, like yourself. How can
Right.
that all happen so that these new moms don't experience that, and moms and our daughters don't experience that?
That's a good question. And everything that I do right now, we are meant to be doing, like educating our patients at the bedside, like making sure that they're giving informed consent. Everything that, like, breath work, position changes, teaching them how to manage their pain, teaching them what Pitocin would do and what a narcotic, how it would affect them, right? But unfortunately, I don't think the hospital system is well enough equipped to teach our nurses how to do it. So nurses have to go outside of the hospital system to learn on their own the different approaches. They have to learn hypnobirthing. They have to learn the skills that a doula would naturally give. There's different resources like bundle birth nurse, like for nurses. They have spinning babies. They have classes specifically for nurses, and we have to search those out. And I see a lot more nurses doing that because we really do want to change the environment and the atmosphere for our moms and relate more to them as women and as caregivers. Unfortunately, like I said, though, what the hospitals are more important for the hospitals is to make sure that you guys don't die, that women don't, that bad things don't happen. So they push policies, they push giving the right medications to the right person, the right time, the right dose. They push when to their assessments. So how are we assessing our patient? Blood pressures, checking their uterus every 15 minutes, like making sure that, and we get so bombarded with all of these tasks and assessments and charting, so much charting on the computer that it doesn't allow us that time. So just like obstetricians or even midwives become so busy with making sure that they get to all of their appointments all day long, that they don't have the time to give that prenatal education. The same thing starts happening with nurses at the bedside, that our hands are so tied. So it really took me like shaking myself a little bit and being like, wait, like, how can I learn everything I can and approach this differently without, and it takes experience too, because when you're so new, you're making a lot of your decisions based on fear because they scare you. And because when you're seeing moms hemorrhage and you are seeing babies barely make it, and you're seeing, uterus ruptures, like awful things we have to see and then we have to fix, stillbirth and all of these things. And we get scared. And now we start basing more and more of our care based out of fear instead of trust. Like trust in the woman, trust that she can make decisions over her own body. Like we're like, oh, well, she's never done this before. I've done it plenty of times. I know that I can help this pain that she's having. I know I can speed it up with some Pitocin. The doctor ordered it. Hey, the doctors are pushing orders on us. So now we're just like, okay, well, we have to do this for the doctor. Like there's so many variables. So it just takes nurses to make that decision. Like I'm going to stand up and advocate for my patient and everything that we do, we're meant to be doing, right? We're meant to be getting informed consent. So if I see a doctor start telling a patient, okay, the next thing what I'm recommending for you right now is that we have a C-section. You've been laboring for this amount of time. The risk of infections going up. It doesn't seem like you're making any progress. So I think the best thing for you is going to be a C-section. And then they leave it at that. Me as a baby nurse would be like just nodding and waiting for the orders and charting that he's, at the bedside giving informed consent, blah, blah, blah. And now I'm like, and I would speak up and I say, and now we're going to discuss the risks of a C-section. And we're going to discuss maybe alternatives. Like I have to remind them, just like I have to kind of remind myself, what does informed consent really mean? Are we giving mom the actual option of a C-section? Or are we just telling her like, hey, we got to do a C-section? What are the risks of having a C-section? And the same thing goes with Pitocin or a narcotic. So the things that I'm bringing to the bedside now are things that I wish all nurses were taught and stressed and know the importance of doing. And it's just not, unfortunately. I really did have to go outside. So I'm doing that at the bedside. But now I see, when you see enough moms like you and I were, and it's still happening, and they're coming in like, Pitocin, I've never heard that word in my life. What's that? And you're like, oh, geez, like we're starting from zero. And how much could I possibly teach in 15 minutes, because it could go any which way. How can I teach them the breathing techniques? Like you can go to a class and learn these breathing techniques, but it takes practice. Like you have to practice meditation and breathing and these calming techniques and learning how to get away from fear in birth. You have to practice it over and over and over every day for weeks and weeks, so that at the time of, it's like second nature, because and I know once labor kicks in, it's like you're in outer space. Like the rocket ship is fused and forget about it. Like, forget about it. Like, you don't know who's talking to you. You don't know what questions are being asked. I couldn't tell you. I just know there was a bright light and there was a lot of people in the room, and I was not present because I was like, get this baby out of me. And my mom was like doing Lamaze in my ear. Like, Mom, you never talked about Lamaze once, and now you're like hee and hoo-hooing in my ear. Like, get away from me. My boyfriend, we were broken up. Like, he was my ex-boyfriend in my labor room crying. I'm like, why are you crying? This is, get away from me. So I had the two people that annoyed me the most in my room with all of these other people that I didn't know. And I'm like, this is awful. This is the worst. And they throw this baby on me with this huge cone head, just like you. She's like purple with white gunk all over her, slimy and wet. And I'm supposed to be like, oh, it's beautiful. And you mentioned like the no social media, but I don't know about you, but I watched the TLC birth story like every day.
Yes, I did too. Yes, dude, is that still on, by the
Girl,
way, the TLC birth story?
I don't know. I don't think so. I don't think
Oh,
so.
yes.
But that gave me a misperception too, because it's funny how differently they treat moms when there's a whole camera crew in the room, right? And then there's like, oh, what a beautiful experience. And they're like, oh, my beautiful baby. And they're crying and everything looks so great. And they're like pushing like, and then they push the baby out. And it's like, that was my perception. So when I was in like World War III, where everything's going like atomic bomb, like you said, like what is happening? I was just had an out of body experience, and I think I left my body for a little bit. I'm like, this is awful, and I never got it back. I never really. That was it. I was like, get me out of here. And just like you, I was not taught anything about breastfeeding. They just kind of shoved the baby on my boob and said, try this. And then, okay. But I was still not connecting. And I was hemorrhaging. Nobody knew, but I wasn't well. Yeah, I wasn't well during my postpartum little period. And I didn't get any help. And yeah, they pushed formula, of course. And I was like, no, I can do this. And formula is expensive. And so I tried, but I got mastitis. I got infections. I felt bad. Like, you and I are not on the outliers either. Like, this is what happens, especially with young moms, I feel like. And I am glad about social media. And you're right. Like, if we see a lot of like these, like the birth story or these like how birth can look, but honestly, it is how birth can look if you know the right tools, if you get help. You cannot just be like, that's how it goes naturally, and that's just going to happen that way, right? So as a birth coach, I say I'm a birth coach. I don't even know if it's a thing or they exist, but I'm not a doula because I don't go to the bedside with my clients. I teach them just like this, like tell where your concerns are. We'll talk through it, and they'll be like, okay, I'm going to give you some skills right now that you can take for the following week and what to work on. And I prepare them for all the which ways that it can go, yes, but really they need the skills so that if however it goes, they feel educated, they're prepared to ask the questions, like what would Patos, like there's some questions that need to be answered before we agree to any type of intervention. And then if on the birthing podcast, I've been doing the first 15, I think I'm just finishing up, where all those things that happen that went on. So the vacuum, the episiotomy, delayed cord clamping, any of those things that we should know are actually decisions that we need to make or discuss with the doctor beforehand, that there's no way at the time of we're going to be able to talk to them about, like, oh yeah, tell me the risks of an episiotomy. Yeah, sure. Like, no, dude, I need to cut your vagina. Like, sorry, this baby needs to come out now. And in an emergency, it's true, but a lot of times they do it and it's not even emergency. So I guide people on that. I guide them how to be a leader in their birth. And a lot of it's communication skills, listening skills, and breath work and mindset, like how to be like you're the VIP in the room. You're the most important person in that room. So those are life skills, I believe. And that's what I try to give my moms when I can, when I'm at the bedside in that short amount of time. But what do you do if your nurse is not going to be like that, and your doctors aren't listening to you and you feel like you can't speak up and you don't have a voice, or you're just not able to? Do you have a doula there that can speak up? Is your partner ready to speak up for you? Do they have just as much of an understanding of what's going on and what your preferences are? Is someone in the room that can be like, what about her? What about Sara? What does Sara need? How is Sara doing right now? Is anyone in the room that can do that for you? Because you cannot count on the doctors and the nurses to do that for you. So that's what I teach. I don't even know if it's a thing. It's definitely not a popular thing. I hope one day it could be. I consider myself a bridge from moms and parents and the doctors. So there's a huge gap, and I think we can all agree, in prenatal care. And I always advocate for a doula, but the doula is also, she's there to support you. But what about medically? What about education on all those things that we do at the bedside as nurses? I could do for you during your prenatal care. So I can visit you. I can talk to you over Zoom to explain what your doctor meant by that ultrasound, and you're not left wondering wait, what's wrong with my baby? I have to wait till the next appointment to find out, or you leave the office with more questions and you're like, why didn't I ask? Why didn't I speak up? Now you have a nurse that you can call and we can have our little appointment and chat for as long as you need to, so that you're comfortable and that you can sleep. I have clients texting me at 11 p.m. Hey, I have a question. Something's happening. I'm like, okay, let's talk about it. And they're like, oh, and all the time they're like, I'm so happy that I have you to just talk to, because sometimes that's all we need as women and moms, right? So that's my little spiel. I've just been going on and on.
Yeah, no, I mean everything you're saying is just such a beautiful asset that really would be so wonderful to have. I mean, when you said about the social media, it's true. There's the pros and the cons. One of the pros is if we had social media when I was up in rural Big Bear, even though you and I are remote, we have a really great connection, and you're trained, and I would have done anything to have that, especially as a young, low income mom, living in a rural area, first time mom. I mean, that you asked if I could have done anything different. If that existed and that was available, all three of my births, honestly, I would have hired someone like you to provide those services. I did have a doula with my third child who what
Let's talk about that. Let's talk about your third
sure.
baby.
So my
I know your second was really interesting, but let's go to your third, just because of time and because I've been talking so much. Let's talk about the differences. You said you pushed for 5 minutes. Tell me the story. But even though I love how you're talking me up and all that,
but it's
I think the
true.
same thing. That's why I'm
I mean,
doing it.
that's
Yeah.
when you and I were first speaking, one of the questions you said, well, what interests you in wanting to come on and share? Well, it's that. I mean, it's something, I mean, it's not, what you do is not simple, but the idea of it, why is it's so simple? Why don't we have a nurse who knows what they're doing medically that can also advocate? Because doulas are great, but just as you said so perfectly, they don't have that medical background, and it's out of their scope to answer certain medical questions. I
Right.
personally hired the third for my third birth a doula because I was in a high conflict relationship, and I was worried about my partner's behavior, to be quite honest. So she was almost more like a cop. She was almost there. I hired her for my partner. She was a new doula. I was one of her very first clients. She didn't have enough knowledge and training that really helped me in terms of understanding how my very quick labor was progressing, and I wasn't actually just pooping, because I thought I was just pooping, but the baby was actually coming out, which was very exciting because the nurse got to deliver her. That's how fast it happened. But so it was really great to have that doula because she knew I already was on edge with my partner and we didn't have a good connection. So that's how she was there for me, was to mitigate any abusive topics he would throw or criticizing my birth. If you can believe that happens, it actually does. I mean,
I
you and
see
I could
it.
go on
Yeah.
and on forever and ever, I'm sure, with so many different topics
Yeah.
after the 5 births we've had and all of the ones you've seen, and friends and whatnot. But it was confusing because I did have a doula. I did get to my goal totally unmedicated. I was with my toddler pushing her on the swing up in Porter Ranch. I could feel the contractions, but by now I know what it means. I know we're still many hours away, and I just want to slip into the hospital, have the baby, and pop out. I don't want to hang around. I have stuff to do now. And so I did. I slipped into the hospital, and I went in through the ER because I didn't like the hospital that I was assigned to. So I went through the ER knowing that was always going to be the process, no big deal. I actually happened to not like the doctor on call because she was my partner's ex-fiance. So that was a whole nother wrench, right? Of all of the things, my
Shut
partner that
up.
I was not getting along with, and we weren't living together, right, at the time. So that was a whole nother wrench. So I was able to, with the help of my doula, thank goodness. That's why she was there. I told my doula, she said, absolutely not. She dealt with it, got a different doctor. Everything was great. So yeah, I had my doula. I called her when I knew it was time. It was close. She lived very near the hospital, so it was not an issue. And she came, and even though this was my third birth, it was the first time that I had completely unmedicated. So it was a completely different experience. The pain was really intense, but it was almost, dare I say, enjoyable, because I
Yeah.
felt so different than my first birth, where I felt the pain, but I had no control. I felt that I was out of control, like in a spinning car on ice. This, I felt very much in control. And my doula just said, if you want to push, push. I mean, we just checked you. You're still far away from that, but you can go ahead and push. So I'm like, okay. So I start pushing, and I start screaming because it hurts. And she says, the one thing she did help me, which is actually a funny story, is she said, if you yell, it hurts more. So if you go deep, your voice is deep, it's better. So I took that very literally because I was, felt like I was dying. And so I would say, okay. And even when I was speaking between contractions, I was scared to have a high voice. So I said, I think it's time. And everything I was telling, my mom was in the room, and the nurses, and then there was a new nurse or something. She was a lower level nurse. She was so thrilled to be, a part of it. And I was talking to her like, can I have some water? And then I said, oh no, I have to poop. I'm pooping. But I was saying it in that voice because I trusted my doula. And sure enough, she looks and she says, no, the baby's coming out. So the nurse, does what she does, and she stands there, and the other nurse goes to page the doctor. And before the doctor can come in, my daughter's head was already out. And so she said, you just have to do one big push and she's out. And she came out, and the nurse that delivered the baby, that was her first actual solo delivery. So she was thrilled. Put the baby, no complications, no bleeding. The lactation consultant was amazing. They were there right away, helped me, even though it was my third baby, still benefited from some different positioning that I hadn't been taught. And then I left the hospital the next day, and I walked on to my older son's baseball field and said, hey, I'm here. I'm back from the hospital. The baby's in the car with Mimi. Let's go. And that was it. I took my son to school on Friday. I was very pregnant. I brought him to school on Monday, and I had a newborn. No big deal. And some of these moms were like, I can't believe you're up and walking around. And I said, well, the world still spins. But thank goodness that third baby was easy, because I had two other children to care for. But I'm just trying to figure out, and I know we're probably running short on time, but I'm just thinking, generally speaking, in the hospital system, not to speak poorly of the medical system, but really the powers that be, it's about money, right? There's not enough money, there's no hospital. So it's an important job, and it's all about money. But you're just thinking, with all the birth complications and what women go through, you would think, if you're looking at the expenses alone, it's so much cheaper if you just invest in a little bit more training and a little bit more billable minutes with each patient, or whatever the case may be, whatever you need to do to reduce all of these problems that you and I had post birth, not to mention we didn't even go into postpartum depression or anything like that. Just the costs alone of not having to deal with postpartum injuries as much, not having to deal with postpartum depression, maybe mothers not connecting with their babies because the birth was so traumatic. You just think the cost alone, it would be so much better spent investing in the prenatal care rather than moms feeling shamed and then not having someone to go to and then posting anonymously on Facebook saying, I'm so embarrassed, I'm not connecting with my child, I don't want to breastfeed, I want to but it hurts, or all of these things that moms feel so embarrassed and shamed about, and it would just be so
Yeah. And then we're meant to be like so independent. We've kind of stripped away, like, you shouldn't need anyone. You can do this on your own. And in fact, you're going to go back to work in 6 weeks. So
right.
snap,
Right.
snap,
And look good.
chop, chop.
And have the same shoes.
Yeah.
The same pair of shoes on your feet. Yeah.
It's funny that you said the low tones. Like one of my lessons, and I had like a coaching call. I'm like, everyone, let's practice because, and I'm like, and I think one of my episodes too, it's like the vibrations in our throat when you speak lower, and I'm like, oh, and I'm literally like at the bedside, like, no, let's all do it together, and I get dads to do it. So you don't feel embarrassed, and especially when you have an epidural because you don't feel that naturally. Like I see moms laboring naturally, it just happens, right? They're like, oh, and it's a vibration that like their cervix poof goes away. And I love it. And I have to like, no, lower, lower, come on, lower. So it's just like, I was dying when you said you were talking. I'm like, I would have loved if I heard them doing that. I'm like, yes, don't be embarrassed. Throw it away. It doesn't matter. Let's all. So I would, as a nurse, be like, how are you doing? So I was dying laughing when you did that because I was like, no, we'll all do it together so you don't feel embarrassed. And everyone's laughing. And guess what? Laughing helps you dilate too. So I'm just like, I was dying. I'm like, oh yeah, I know exactly. I love your doula already. She's probably doing a great job. I hope she's still doing it.
She's not. She's now doing home inspection.
Oh, what? Oh, she's like, too much, too much. I see too much.
Yeah, who knows?
It's like Sarah was a one and done.
Yeah, I mean, maybe I still on my daughter's birthday, I
Yeah.
still always send her a little message, just because
Oh,
it was.
doulas are amazing. They really are there to support you. And like you said, your partner too, even if it's just to like shut them up. It's all about protecting mom's space and her privacy or safety. How does she feel? Like, how do you protect the environment around her? And sometimes it can be a mother-in-law or their own mom that they're like, well, sweetie, are you sure you want to do that? And you can't do that. And this, why don't you just listen to the doctor? And why don't you just get an epidural? Your face looks like you're not doing like, and the doula would be like, why don't we go get some coffee? Let's get out of here. It's like, protect your space. And please don't, if you don't want your ex-boyfriend and your mom in the room with you, how do you find your voice? How do you stand up to them? And that's what I do. That's what I'm like, I'll teach you
Yeah,
how,
I would
because
have.
you only get one birth. You get one birth with that one baby, and that's it. And how is it going to go? How are you going to stand? If you can't stand up to your mom, how are you going to stand up to your doctor? How are you going to stand up to how are you going to voice what you need when the time comes? And sometimes you need some coaching when it comes to that.
It's so important. I mean, on topic, but kind of funny. Did you see The Bear? Did you see that show, that series on? I think it's on
The
FX.
show,
So
yeah, not
there
all of
was
it,
this.
but I PTSD because I've been in the service industry for so long. I'm like, this is all. I don't want to watch this. The restaurant industry is almost scarier than the birth industry.
Well, so I don't know how far you got along, and maybe any of your listeners, but so one of the characters has a baby, and she has a very complicated relationship with her mom. And I don't know if you got that far. Anyway, she has a complicated relationship with her mom. Her mom is an alcoholic narcissist, and she sort of, bared the brunt. There's three siblings, and she had her own unique relationship, but she decided just not to have any contact with her mom because it was so difficult. Got pregnant, didn't let her mom know. Of course, goes into labor. The only person who answers the phone is the mom. And so that whole episode is really her navigating her really difficult relationship with her mom when she actually also needs her mom, at the same time. And it's really, to me, it was just to watch it because I had been in something. I shouldn't say similar, but some of that feeling felt very familiar to me. And it was just interesting to watch. You should definitely watch it. Sit down first, have a nice blanket and cup of tea, whatever, because if you've been through that kind of,
It's my calming
yeah,
trick.
they depicted it really well. And it's just interesting. And no one was really there. Like the nurses were, in the show, they were seeing that the connection was bad. They were seeing the mom was overbearing and annoying, but nobody stepped in to help, the character.
No, we won't. We don't want to get involved in your family
Right. Right. But
issues.
she was,
Sometimes we'll bring stuff up, but or ask questions when the mom's not around. Like I sometimes I give a code word to the patient, like, ask if you feel like your mom is too much and you're starting to get stressed or anxious, ask for some apple juice. And then I know that means that I need to do a procedure, quotes in quotes, that she needs to step out. And then and then when she steps out, I'll tell the mom, like, it might be a while. This might be a good time to go maybe run an errand or go get some rest. And we'll let her know how you're doing. Like we don't mind being the bad guys at that point. So little tricks like that.
I mean, that's so important, especially, something else, again, it's a totally different topic, but when you're in a relationship where there's domestic violence and now you're a patient and now your abuser is in the room, that's a
Yep.
whole nother part of it. And same thing, the nurses really play a key role in that. Do they feel that they have the authority to step in and help that mom? It's a very hard situation. I mean, both both
Very.
mom and they're both parents, right? So it's both their child. And you're a medical worker, what do you do? But you can clearly see the mom is in distress. You don't know the background. Maybe you do know the background, or you think you can see the red flags. That is such a wonderful thing that nurses could do and probably should do it at every intake, is have a quiet, are you safe? Is your partner
Yeah.
safe? You know,
Yeah.
and that if they would have asked.
And we do. And we get lied to a lot. And we have to see it for ourselves. And we can't do anything until it escalates to a point that we don't feel safe. And then we have to have them escorted out. We have to call, for safety. Oh my gosh. What am I? I'm blanking
Security.
on the guys. Yes,
Yes.
security. We have to have security involved. We get threats. I was at UCLA and the dads, we had to ask him to leave because they were like fighting, like literally like fighting in the room. And it would look like it was going to get physical with mom. And this was postpartum with a newborn in the room. And we had to escort him out. And he said, I'm going to come back and shoot everybody here. And he left. Great. So now we're like on high alert that there's possible upset dad that's going to come back with a gun and put us all and all the families at risk. So now we have to have police like circulating. It gets to that point. It's crazy. So, but when do we step in? How do we have a voice? How do we advocate as nurses at the bedside? Like, when is it appropriate? When isn't? It's very difficult. Very, very difficult. You're right. And that could be a whole nother topic. But I think we've talked so much. I think we've hit so many great points. And I have to thank you so much for coming on and sharing your story. What can you leave us with? Like, what's your tip as a mom of three that have gone through it all? What would you leave us with, me and our listeners?
I would definitely say go in with an idea of what you want, but equally so an open mind, knowing you don't know what's going to happen. Going in prepared to trust your team, but to also be prepared to advocate for yourself when you need to. I think if you go in scared and thinking automatically your nurses are going to be, the horror stories maybe that you and I discussed, that's equally as dangerous, because you may not even have that, but you may set the tone and it sort of manifests that way because you come in with that. So I think everything that you're doing, again, to toot your horn, I mean, everything you're doing is what's missing for moms, especially underserved moms, in domestic violence, or who were young like us, or didn't have the support system maybe we would have liked, or the prenatal care. Because, like you said, it's still happening to so many. So many people have great, beautiful births, much like my third. And so many people have difficult ones like you and I did for our first. And you can be an expert, you can be a nurse and a coach, and you can know everything. But when you're the patient, just to have that support and someone call you by your name rather than mom or mommy or mama, Oh, you do know who I am. I'm not just, flipping through the chart, Pitocin at 5 or whatever. So I think that that's what I would say.
Oh, that's awesome. I love that. Thank you so much, Sara. It was so nice catching up. Stay on and we'll chat after I stop
All
recording.
right. Likewise, thank you for
But
the opportunity. I'm so honored to be able to share my story and connect and see all the amazing work you're doing.
thank you, Sara.
All right. All right.
Bye.
Bye.
Hey, I really hope you enjoyed this episode with Sara G. I know I did. I just love birth stories, you guys. So if you're interested in maybe sharing your birth story, it can be really therapeutic. You can get your story out. We can discuss it together. No judgment, just sharing. And you'll see how much it feels good to do so. Go to my website, myfriendsandnurse.com/podcast. And at the bottom, you'll see, would you like to be a guest? Just click on that and send me a message and let's get you in. And if you maybe want the value of sharing your story, but maybe just not on a public platform, then why don't you just write to me you can DM me at My Friend's Nurse on Instagram, or send me an email at Colette@myfriendsnurse.com. And we can set up a little call where you can tell me your story just one-on-one. And we can rehash maybe feelings that you have behind it, especially if there were any traumas, even micro traumas, or even if not, even if it was just, hey, this was a great experience, but have you spoken to someone about it at length without them jumping in or having their say? You might really find a lot of benefit from that. So send me a message and let's do that. If you are pregnant, remember February cohort is starting February 2nd. So there are still spaces. Please sign up. You can go to myfriendsandnurse.com/February to get your spot. And I'm just so excited to start that one. December, January are closed. So we're going to be restarting in February. And yeah, for now, you could get the hospital crash course on the website. That's 3.5-hour class. Amazing. I think you'll like that. Or the whole birth link course is also available, but I really recommend, it's about the same price to just sign up for February cohort. And then you can get started on the class right away. You don't have to wait till February. All right. So thank you so much again to Sara. Next week, I am going to start a new series. So we did the first 15, but now I'm starting to get into the second stage of labor. So I was going to do the vacuum and forceps. So I want to study that and do some research, and I want to speak about it. But before that, I'm going to just get into what the second stage of labor is, right? The pushing phase. You just got to 10 centimeters. What is the history behind that? It's quite an interesting story, actually. What is involved in pushing? What are the positions you can push in? Who are you pushing with? Is it always your doctor? Not necessarily. So we're going to get into second stage of labor. Next week, I am going to go specifically into what the second stage means. And then from there, we'll go into like forceps and vacuum and tearing and pushing and all that fun stuff. All right. So until then, have a great, great week. Enjoy your holiday season. Bye. Thank you for listening to My Friends and Nurse presents the Birthling Podcast. We hope you enjoyed today's episode and found it valuable. Before we go, a quick reminder. The information shared on this podcast is for educational purposes only and should not be considered medical advice. Always consult with your healthcare provider for any medical concerns or questions. If you enjoyed the episode, please subscribe, leave a review, and share it with your friends. Your support helps us reach more people and continue to bring you great content. Until next time, stay healthy and stay informed.